Now you're going to shift your hips forward, so bring your hips into extension. Tuck the pelvis underneath you. Bring your arms out to 90 degrees. Fully extend your elbows and wrists. Maximal external rotation. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm going to be sharing with you a lower body myofascial stretching routine. If you guys have been following me for a while, you know that a few weeks ago I was asked by one of the moderators in the Discord server of John Glad Van Dam, aka Obese to Beast, to host a workout for their Thursday Discord workout class. Basically, every single Thursday at 7 p.m. Pacific, 10 p.m. Eastern Time, they host a free workout for their Discord members. So if you're looking for a free workout, go ahead and join that group. But a few weeks ago I was asked by one of the moderators to host a class, and I said, yeah, absolutely, I'd love to do it. So I decided to take them through a 60-minute Eldoa class. If you guys haven't seen the full video, I'm going to include a link right up over here to the full 60-minute class, but basically the reason that I selected these particular exercises is because a lot of patients that come to me, they present with low back pain, and a lot of people that have low back pain, it's going to be to some type of dysfunction in the lumbopelvifemoral complex. I elaborated on this in another video. It was called 10 Years of Low Back Pain and Sciatica Gone. I'm going to include a link right up over here if you haven't seen it, but essentially with regard to this issue, a lot of people are going to have really tight psoas major muscles and rectus femoris. Both of them are going to attach to the pelvis. So when these muscles get really tight, it's going to lead to anteversion of the pelvis. And a lot of people are going to have excessive anteversion or an anterior pelvic tilt. So by incorporating the myofascial stretching for the psoas major and the rectus femoris, we can help to neutralize this. So if you have any type of issues with regard to low back pain, or if you just have any type of lower body tightness, these would be two terrific stretches that you can incorporate into your stretching program. But without further ado, here are the stretches. Now we are going to do some myofascial stretching, and we are going to start with the myofascial stretch for the psoas major. So for this one, the knee that is on the floor, you want to get into the bottom of a lunge position, so a half kneeling position. The knee that is on the floor is the side of the psoas that we're going to be stretching. So I have my right knee on the floor, I'm going to be stretching my right psoas. What you want to do for this one, maintain a nice tall spine from your knee all the way to ear, one line. Next, your ankle, you want to bring it to the outside of your knee. The foot that's on the floor, kind of walk it over a little bit, and you want to shift your hips over to that side. Now you're going to shift your hips forward, so bring your hips into extension. Tuck the pelvis underneath you. Bring your arms out to 90 degrees. Fully extend your elbows and wrists. Maximal external rotation. The side of the knee that is on the floor, you are going to bend to the opposite side. So if your right knee is on the floor, you're going to bend to the left. If your left knee is on the floor, you're going to bend to the right. Now you are going to rotate to the side of the knee that is on the floor. So if your right knee is on the floor, you're going to rotate to your right. If your left knee is on the floor, you're going to rotate to your left. You want to keep your chin tucked in and maintain all of these different components. So pushing out with the ankle, retroversion of the pelvis. Bring your hips forward, keep the chin tucked in, push the crown of the head up, maintain the lateral flexion, maintain the ipsilateral rotation. So make sure you're pushing out with that ankle. Keep the retroversion, keep that chin tucked in, push the crown of the head up. If it feels easy, you're probably losing at least one of the components. Make sure that you're doing everything. Push that ankle out, push the ankle out. Tuck the pelvis underneath you, and slowly come out of it. We're going to do the other side now. So the knee is on the floor, you're in that lunge position, ankle outside of the knee. The opposite foot, you're going to walk it over a little bit, glide your pelvis over to that side. You're going to shift your hips forward, tuck your pelvis underneath you, arms out, extension of elbows and wrists, maximal external rotation. You're going to bend away from the knee that's on the floor, rotate toward the knee that's on the floor, keep your chin tucked in, push the crown of the head up toward the ceiling, and maintain all of those different components. So really focus on pushing the ankle to the outside, keeping the retroversion of the pelvis, keeping the chin tucked in, the lateral flexion, pushing the crown of the head up. 15 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. Do you want to alternate these, or do you want me to just go?
Just go.
All right. So next we're going to do the myofascial stretching of the rectus femoris. For the rectus femoris, we're in pretty much the same position to start. So in that half kneeling position, one knee on the floor, one foot, The knee that is on the floor, that is the side that we are stretching. So whatever knee is on the floor, with your opposite arm, you want to grab a hold of your ankle with that hand. You want to try and get your heel to touch your butt. Now you are going to get nice and tall. Your arm right out in front. Extension of elbow and wrist. Maximal external rotation. Bring the arm up. Keep the chin tucked in. Push the crown of the head up. The main thing for this one, we want to hold all of those points of contact, but you really want to focus on keeping the heel toward your butt. If you have really poor flexibility, then using either a towel or a stretching strap would be really good for this one over here. 5 more seconds. And relax. Now we're going to switch legs. We're going to do the myofascial stretch for the rectus femoris on the opposite side. So we're in that same position. The knee that's on the floor, use the opposite arm to grab a hold of your ankle. Get your heel to touch your butt. Get up nice and tall. External rotation, maximal external rotation. Arm up, try and get it in line with your ear. Keep your chin tucked in, crown of the head up. Keep that retroversion of the pelvis. So the rectus femoris, the two main actions are hip flexion and knee extension. So you really want to try to extend the hip as much as possible and to flex the knee as much as possible to get as much of a stretch on the rectus femoris muscle. 5 more seconds. And relax. And there you have it. Those are the myofascial stretches for the lower body, specifically the psoas major and the rectus femoris. So if you do have any type of pain in your low back, or if you have any type of tightness in your lower body, go ahead and give these stretches a try. That's pretty much it though for today's video. If you enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.